Hey, it's the Dear Blackledge here at our 12th annual open house, and Jamie is doing a microneedling. Some people call it a skin pin. Jamie, tell us a little bit about that if you don't mind.
So the skin pin, we're going to put tiny little fragmented, tiny little holes into the skin and stimulate the collagen. Now, what we're offering at the open house this time, we have 3 different kinds.
And those things have taken off because microneedling, it's all about poking little holes in the skin.
It's a controlled injury.
But it's also about what you put then in those little holes, right? And we've started doing some different things because if you're just offering microneedling, you're about 5 years behind.
You are. So what I did on her is that we actually put B5 in there. It is a SkinCeuticals treatment that we're actually putting there to help hydrate her skin. And then we also use the Botox facial, which that patient asked, how does that work? That deals with your oil production. That's why it's great with pore size. Like you could benefit from that.
I love that because basically we poke little holes, thousands of little holes through this little microneedling gun into the skin, and then we drop micro droplets of Botox into those holes. And so what happens is those little Botox droplets, they stop the production of oil, they stop the contraction of pores, so it takes care of pore size.
The word glass is the best description ever.
It does. It makes your skin look like glass all of a sudden because you don't have pore size problem. You don't have those little fine lines. Now, another thing that we do with microneedling, so sometimes we put Botox in the little microneedling holes. Other times we do something called PRP.
Platelet-rich plasma. And so that's a superb treatment. So that's the vampire facial.
Exactly. And so what we'll do with that is we'll draw some blood from our patient, spin it down in a centrifuge, and then you've got the plasma, which is rich in proteins and peptides that help the skin to heal itself much quicker.
And so this is, how do you pick a skin pin? That's one of our biggest questions ever. So, I think it depends on what your outcome is. And so when we do her, like she's on maintenance right now, so we've cocktailed with Botox before on her. So her pore size, we've done that for her to contract her pore size. If I'm stamping the patient, if they're really thick and sebaceous and I know they're going to have problems healing, PRP is the way to go. The older patients that say, I really struggle with healing, that's the route that they need to go. And one of the things about doing the Botox facial is going around the eyes and right around the T-zone. It is incredible.
It's amazing.
It really
is. So that's the take-home message. Microneedling's been out how long?
Oh, gosh. I think we've had almost 7 years now.
7 years. And it's a great treatment. But the thing that I love are the things that we've started adding on to it. The Botox, the PRP. That's what makes it great now. It's not so much just the microneedling, it's what you're putting into the little holes to help the skin build itself.
And for our patients, you can always tell them, you don't have to plateau. If you have an area that you're concerned with and you feel like we're not reaching it, hey, let's cocktail it.
Absolutely. Basically, I think that microneedling is the gym. It's the working out with the weights. But the stuff that you're putting into the skin after the microneedling, that's basically that's the nutrients that you eat, the protein, all that kind of stuff that you take after you finish working out. Do you agree?
I agree wholeheartedly. And the patients are totally comfortable. People ask all the time, are you uncomfortable? Regardless of which route you go, you're comfortable. We don't want our patients to hurt.
No.
We want them to come back. How often do you get them? When we start, I tell them 1 per decade. So if you're 40, you're looking at 1 a month for about 4 months, and then about every 12 to 16 weeks of maintenance. You can see she has a little bit of edema. It's not really bad. She's totally comfortable. We'll do some recovery creams on her, and it's pretty easy.
Her pore size has gotten incredible since you've started doing these, haven't it?
Yeah, she's really pleased.
Well, anyway, microneedling here at the Blackledge Face Center. Not just microneedling, but the microneedling Botox, the microneedling with PRP, and then microneedling with whatever else you choose to cocktail it with.